Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guests are Erin Meek, Nurse Navigator for Breast Cancer, and Heather Nist-Weisel, Cancer Center Dietitian, both with Aultman Cancer Center. Good morning, ladies, and welcome to the show.
Thank you for having us.
Good morning. Thank you very much for having us.
Okay, we'd like to remind our listeners today that our program can also be found on our podcast. Just look for Medicine Center Pharmacy and Health Matters in your favorite podcast app, and please subscribe to our program.
So, how about each of you telling us about your career with Aultman and your current role?
So I am the oncology breast navigator here at Aultman. I did start out on the oncology floor here at Aultman for about 10 years. And then I took on the navigation role, and we're kind of going to get into what that means. And I've been doing the navigation for about 12 years.
Okay.
And myself, I'm one of 3 registered dietitians on the nutrition team here at Aultman Family Cancer Center. And prior to this role, I've served in Aultman Weight Management for 10 years.
Is the food good? I've been in the hospital a few times, and the food at Aultman's always been good, and I'm
Good, I'm glad.
But people, I think people are just so persnickety about what they want. They expect the same thing in a hospital.
Of course.
So anyway, good, thank you. So, what is cancer patient navigation?
So, cancer patient navigation came around locally when it has shown that it has some benefits for people at risk and those that are diagnosed with cancer. Our goal, really, as a navigator, is to address any barriers to care, such as financial, psychological, social, any logistics that would prevent a patient from being able to have what they need as far as treatment or surgery. And so we assess those things, but mainly educate the patient, kind of be a rapport between them and the physician, and then also offer support for them throughout their journey.
It's a tough one, isn't it?
It is, but it has its rewards too as well. I work mostly with breast cancer patients, and so they typically do pretty well. I'm lucky in that aspect.
So what cancer sites does Aultman offer a navigator for?
So we have dedicated navigators for breast cancer. We have a navigator for lung cancer. We have a navigator for GI, which is gastrointestinal cancers, such as pancreatic, colon cancers, things along those lines. And then also our GI navigator does head and neck cancers. And then we have a GYN navigator, which are female cancers. And then she also does GU for men, which is prostate or, bladder, those kinds of sites as well. We also of course, that's not all breast cancer sites, but if we have a need of a patient that needs a navigator, we certainly will take them as well, even if we don't have a dedicated site for them. It's by referral, and our physicians do very well with letting us know if there's a patient that has needs.
Okay. So tell me about your educational background. How do you prepare to become a nurse navigator?
Well, here at Aultman, they prefer that you have, of course, an oncology background. They also do prefer, that you are a nurse. There are lay navigators in the community, which is wonderful. But here at Aultman, they do prefer that a nurse have this role. And then there also are a couple certifications available out there to become a certified navigator. I'm an oncology certified nurse as well, which helps you prepare for taking care of cancer patients.
What other disciplines are available to help cancer patients?
So we're really lucky here at Aultman. We have a very good support team for cancer patients. We have a dedicated social worker. We joke and say we don't know what we did without her beforehand because she just is such a godsend to us with our patients. And like Heather said, we do have 3 dietitians on staff, which is great for our patients that get treatment that inhibit their swallowing and their nutrition. And then we also have a survivorship coordinator that helps. She runs our support groups. And then she's also there for patients that are done with treatment, but kind of just need some extra support and not sure what's next along those lines.
So what support services are available for cancer patients?
We have a support group here called Moving Forward. Denise, the survivorship navigator that I mentioned, she does run that. And what that is, it's a support group for the first hour. And then after that, we do have a massage therapist that comes and does massages for our cancer patients, and then also a Reiki therapist. And then if the patient identifies any other needs after the support group, if they would want to meet with the dietitian or the social worker, things like that, we can do that in that time frame. We also do have a free wig bank here too for patients that would like a wig for free. It's run by the wigs are donated by the American Cancer Society. And we have volunteers that come in and that are educated on wig fittings. And they run a clinic on Monday and Wednesday mornings to assist with a patient that would want a wig. We also are very lucky. Our community is wonderful with donations. So we have a cancer care fund. And what that is, the navigators, we assess patients for their financial needs. And if they're struggling with gas or things along those lines, we do get patients that come from far away. So we can help with gas cards. And then the thought of the grocery cards is to, assist with groceries and possibly free up some money for other things that they may need. So that comes out of it's called a cancer care fund. Our community donates into that. And then we also do raise funds for that. We also have a breast specific fund for breast patients that we can do gas and grocery cards from. That is funded by when you go get your license, you can get a breast cancer license plate, and we get funds from that to help with patients that need gas and grocery cards as well.
Wow.
So we're super lucky there.
Very interesting.
Yeah.
So how does a nurse navigator work with patients and doctors?
So a lot of times what we'll do is we'll sit in on patient visits, whether it be with the surgeon or whether it be with the oncologist, to try to just be an extra set of ears for them. Sometimes that's not possible, but we just kind of act as a rapport between the navigator and the physician and just communicate between all of the physicians and just try to help the patient stay on track. I mean, it's very, very overwhelming in the beginning with appointments and times and scans, and just to try to help them manage those appointments and be a communicator between the physician and the patient. Yeah.
Gosh.
All right, Heather, how about a role of a dietitian at Aultman Cancer Center?
Yes, so the nutrition team here at the Aultman Cancer Center offers patients comprehensive nutritional support, basically to optimize their health through the cancer journey, because nutrition greatly impacts treatment tolerability, outcomes, and quality of life.
Okay. How can a patient...
Go ahead. Sorry.
That's okay. How can a patient get nutrition services?
Yes. So if you're currently a patient at the Aultman Cancer Center, you can ask for a referral. We also get a lot of our referrals from a malnutrition screen. So if a patient comes in to radiation or oncology and reports recent weight loss or a decrease in appetite, then a referral to our team is generated.
You know, in the distant past, okay, a lot of patients, cancer patients, who were having issues with their, food and all that sort of thing. The individuals involved in the medical centers were not really suggesting like a boost product or ensure or some of those products to keep their weight on and to keep the nutrition up. So do you have a brand of products that you suggest for individuals that require nutrition? Or
Yeah, well, there's a lot of good ones out there on the market. Boost and Sure both are very large companies that offer those nutrition products to clients and the general public as well. And then there's some plant-based ones like Orgain and many other just as good products that you can get on Amazon and sites like that.
I'm type 2 diabetic, and I use Boost for diabetic individuals, and I find it very useful as far as vitamins and nutrition and and all that sort of thing goes. So probably should use more because I've been losing weight, but that's my choice. So I'm not endorsing it. It just happens to be on the can. It says for people with diabetes, and I said, okay, why not?
Yeah. So that's a good balance of carbohydrates and macronutrients. It allows your blood sugar to rise steadily and come down steadily.
Gotcha. So what are some of the resources in the community related to nutrition?
Yes, well, as Erin said, we have a lot of supportive resources here in Northeast Ohio. Another one is Compassion Delivered, which is a nonprofit organization whose mission is to deliver high quality, nutritious meals at no cost to patients who are suffering from life-threatening or terminal illnesses. Another is Aunt Susie's Cancer Wellness Support Center, and they help women with social and emotional supports like transportation, wigs, house cleaning, companionship. And then if you have head and neck cancer, the Head and Neck Cancer Foundation is excellent for resources with patients with financial need. That is based on financial need. And then the one that Erin mentioned as well was the Cancer Care Fund, which we do fundraising here through Aultman and donations to support.
Okay, very good. It is time for our first break, ladies. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy, friends. Just a reminder to stop by the pharmacy and talk to our pharmacist about our Health Matters membership savings program. We want to help you stay well and save money. So, how does cancer impact a person's nutrition status?
Yeah, good question. So cancer itself increases metabolism and can lead to muscle wasting. And then the treatments as well can cause side effects that impact nutrition. For example, if you have poor appetite, then you're going to eat less, which can cause weight loss and can lead to malnutrition. And then the treatments like radiation, depending on what part of the body is being radiated, can cause taste changes, dry mouth, and chewing and swallowing concerns. And all individuals here at Aultman that have head and neck cancer are referred to the speech therapist on our team. So that's a big asset as well. And then chemotherapy can cause a lot of GI symptoms, such as nausea, vomiting, constipation, or diarrhea, as well as impact the digestion and absorption of nutrients.
So, what are some nutrition goals for people who have cancer?
Yes, well, our goal on the nutrition team is to help you develop and implement a personalized plan for optimal nutrition to get you through this journey with maintaining your weight as best as possible and your health through treatment. And sometimes we have to get creative. For example, if a patient comes in and says, this week everything is tasting metallic, I'll say, okay, what are you willing to eat or drink? And there are strategies like eating with plastic silverware instead of metal that we can do. But at times like these, as you mentioned earlier, that we may need to use some oral nutrition supplements like Ensure or Boost or a plant-based one or we have lots of recipes as dietitians to make your own high protein, high calorie drinks. And sometimes people will come in overweight with excessive weight to begin with, and they're excited when they're finally starting to lose weight through treatment. And I tell my patients all the time, cancer is not a good weight loss plan. This is the time where you want to maintain your muscle mass to best tolerate your treatments and minimize your fatigue and maintain good energy.
Very interesting. Okay.
All right, well, let's talk about cancer prevention and screening. What percentage of cancer is preventable?
According to the American Cancer Society, 42% of cancer is preventable by making healthy lifestyle choices. And that is good news.
So let's talk about healthy lifestyle choices related to healthy foods. What are some foods that can help be promoting of maybe a cancer-free lifestyle?
Yes. Well, a lot of times people don't know or they forget that 70% of our immune system resides in the gut. That is huge. So there are many dietary changes that we can make to maximize that good gut microbiome, which will greatly impact our immune system. How to do that is a long conversation for another time, but let me leave you with a takeaway. Increase your fruits and vegetables. Your mom was right. You eat more vegetables. They're full of phytonutrients and prebiotics.
All right, what are some other lifestyle choices that people can make to decrease their risk of cancer?
Yeah, thanks for asking. So the top 6, be tobacco free, maintain a healthy body weight, enjoy alcohol in moderation, engage in regular physical activity, minimize sun exposure and tanning beds, and last but certainly not least, eat nutritious foods. The standard American diet often leads to standard American diseases. And when I say standard American diet, what I mean is highly processed foods, high amounts of added sugars, refined carbohydrates, low fiber, and not enough fruits and vegetables. Instead, choose freshly prepared foods, healthy fats, fermentables, and 5 or more servings of fruits and vegetables a day. I've yet to tell a patient in 25 years they're eating too many fruits and vegetables. I would love to be able to tell somebody that someday.
Hey, the peaches are great right now.
The peaches are so good. Yes. So think local, think in season, and enjoy some of those summer fruits, especially right now.
Yep, that's for sure. There's a fella in Louisville that grows blueberries. Oh my God, they are no poison, no nothing. Just they're just absolutely fabulous.
Ooh, may have
It's,
to share that information after.
Yep.
Yeah. And sometimes it's just about how you're going to prepare them. For example, vegetables. This is grilling season. So if you're grilling a lot of meats on the grill, can you add some fresh zucchini, fresh peppers? Those are prolific right now in Northeast Ohio. And we're getting into fall where you can roast a lot of the root vegetables like carrots, Brussels sprouts, and squash, things like that, that bring out, and roasting and grilling bring out their natural flavors, add some spices and seasonings, and it takes vegetables to a whole new level. Oftentimes I'll recommend Brussels sprouts and a patient will say, "Oh, Heather, I don't like Brussels sprouts." And I'll say, I challenge you to try them roasted and you come back and tell me what you think. And they come back raving. They're converted to a Brussels sprout believer.
Yeah, very good. I think they're very good. So, okay. What route does a patient navigator play in the community for cancer screening?
So we try to go to as many community events as we can. Aultman participates in many community events here in the Cancer Center. We try to tag on to some of those. I don't know if you've seen the Wellness on Wheels or the WOW van out and about. So we try to sometimes go with them to events where we try to promote screening. There's a lot of questions out there about when you should be screened and when. There's a lot of different guidelines, unfortunately. I wish we could kind of all just hone in on one system for screening. And then we talk about screening at those community events. And then also we do free mammogram screenings in October. So we do have a free screening event coming up here October 11th, where you can get a mammogram for free. Normally, insurances do pay for a screening mammogram, but there are some ladies out there that don't have insurance, or there are some insurances that won't pay for a screening. So we offer this free event, funded once again by the funds that we were talked about earlier, where we offer free mammograms. I think we're gonna have 25 slots this year. So stay tuned for our social media sites to be promoting that if you want to get registered.
Interesting. Wh- What what risk screening guidelines does Aultman recommend?
So Aultman recommends what we call the NCCN guidelines, which is the National Comprehensive Cancer Network guidelines. We're always going to kind of follow with those, but they're also kind of in line with the American Cancer Society. But we still always recommend a mammogram annually at 40. Some of those other guidelines have said that, that it's okay to go every 2 years for a mammogram, things like that. We are still going to endorse that you should have a mammogram annually at 40. You also can get a baseline at 35, which I think we're going to talk about in the next question.
Okay. Okay, ladies, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You are listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking with Erin Meek and Heather Nist-Weisel. So, do people have to wait until they're 40 years old to get a mammogram? And do men get mammograms?
Yeah, that's a great question. So typically, yes, we want you to wait till you're 40 to get an annual mammogram. Which is a screening, which is for somebody that's not experiencing any problems. You could also have one as a baseline at 35 and then again at 40. But of course, if you're experiencing, any abnormalities with your breast or any lumps, bumps, things like that, we certainly want you to let your physician know, and you can get a mammogram earlier than 40. And also, so men don't get regular mammograms, but of course, men do get breast cancer. So a mammogram would be done on a man if they were experiencing a lump or something abnormal in their breast tissue, and then they would have a mammogram at that time and a workup.
Okay. Men don't develop as much tissue in their breasts as ladies do.
Correct.
Why do they get breast cancer?
It's just kind of, one of those rare things. Sometimes it's genetics. A lot of times when a man does develop breast cancer, we always run a genetic panel on them to make sure that because it's pretty rare. It does happen, and there is still some breast tissue, that a man has, and it develops there for reasons, that are not known.
But in ladies, females, cancer develops in the fatty tissue.
Yeah, usually in the fatty tissue of the breast, or a lot of the breast cancers in women start in the duct, which is the duct is what leads with a nursing mom would the breast milk would come from the globule out to the nipple, and that's the duct. So that's a lot of places where the breast cancer does start in women, but it is essentially the fatty tissue.
So before our commercial break in the news, you had mentioned that there were some opportunities for programs to assist those needing a mammogram. Could we cover that ground again?
Yeah, sure. We do have several funds and grants available through Altman that we have graciously been donated to help with screening mammograms and any breast imaging that a patient may need. We also have a free mammogram screening event coming up October 11th in the Breast Center at Altman. So watch for your social media sites for that to get registered. Typically, screening mammograms are covered by insurances, but some ladies don't have insurance, or there are some rare insurances out there that won't cover a screening. So we have these in the hopes that somebody that wouldn't normally get a mammogram would go ahead and take part in this. We also can do free mammograms as well, in addition to a free screening event, if that makes sense. And so at the end of the program, I can give you the phone number to call to get a mammogram for free if needed for somebody that doesn't have insurance or if their insurance doesn't pay.
Hmm.
How about we touch on too, I think we've all been taught in our healthcare careers that screening is often the best prevention. And sometimes you don't know what you don't know. I can't tell you how many people we've taken blood pressure for in the pharmacy that had no idea they had high blood pressure. So what about other cancer screening guidelines, as Altman may recommend, whether it be colon cancer, lung cancer, prostate cancer? Can you touch on any of those if you have them at the
Sure.
tips?
Yep. I sure do. And one of the things I forgot to mention earlier with the breast screening, of course, this is all for women or men with average risk with the cancer screenings. Sometimes, there are higher risk patients with a family history or, dense breasts, things like that. So these screening recommendations are for those that are at an average risk. So, like we said earlier, a screening mammogram at the age of 40. And then it's always very beneficial just to be aware of your breasts, if there's any changes, any lumps or bumps or things like that, because you definitely want to report that to your physician. We've kind of gotten off of the realm of doing breast exams monthly. We kind of don't teach that anymore. It's just more breast awareness. Just want you to be aware of any changes. And then always encourage you to discuss your risk factors with your physician. You may need screening earlier if your mom had breast cancer or if there's a genetic component in your family history. I'm sure that you've heard a lot about BRCA 1 and 2 increases your risk of breast cancer and other cancers. With prostate screening for men, the average risk, these are for average risk men, sorry, ages 45 to 75. So that includes an annual exam and a PSA test every 1 to 2 years. That is a blood test that gives us a level. That could be expanded to every 2 to 4 years, depending on what your PSA level is, if that makes sense. And so again, always discuss any risk factors. If you have a family history of prostate cancer, you may want to let your physician know that. Colorectal screening. This again begins at age 45. They just lowered the age. It used to be 50, so now it's 45. They want you to either have a colonoscopy or a stool test annually. A colonoscopy is every 10 years. Of course, if it's normal, if it's abnormal, then they're going to have you do that more frequently. Lung cancer screening, we do have a low dose CT screening for patients that are current or past smokers, ages 50 to 80 years old with a 20-pack year history. So that always confuses me. So I asked our lung navigator to elaborate a little bit on that for me. So a pack year is used to describe how many cigarettes one have smoked in their lifetime. So one pack, of course, equals 20 cigarettes. So if you've smoked a pack a day for the last 20 years, or say 2 packs a day for the last 10 years, that's how we get the 20-pack years, if that makes sense. And so, of course, if you're not sure if you're eligible for a low dose CT, you can always reach out to us, and I'll give you the phone number here at the end. And then that will determine if you're eligible for a low dose CT screening. And then with GYN, which is ovarian, cervical cancers, that is not as cut as dry as some of these screenings. So they do recommend a pap smear and an HPV screen, which human papillomavirus screening starting at age 25, I believe. Don't quote me on that. And so then depending on those risks and if those testing, what those results are, that will determine how often you need to have more HPV and cervical screening. So please, the bottom line there is discuss that with your physician as far as your cervical and screenings go.
So, you made me think about something earlier when you mentioned that you guys might have a genetic test run on a man if he developed breast cancer. And this question may be beyond the scope of our program today. And if it is, it's okay. But, it just seems like with genetic testing, there's a lot of opportunities to identify risk factors that could
Mhm.
really set a patient up to be on the offense rather than on the defense. Do you see in your healthcare settings are preventative genetic tests getting more popular, or are we still kind of battling the insurance plan to allow these? Or what's your personal feeling, if nothing else, other than it seems like it could really be an asset for people if they know they've got a marker that could set them at odds?
Oh, definitely. We've come a long way with genetic testing here, not at Altman, but I mean this time, this day and age. So there are things that go into deciding whether or not a patient needs genetic testing. Of course, family history of in my breast world, of course, like breast cancer
Hmm.
in moms and ovarian cancers, or just a family that's got a lot of cancer in it. Insurances are really coming around with allowing those testings to happen, although a lot of times the patient already has a cancer diagnosis before we're running these tests. And so that a lot of times it is
Hmm.
approved by insurances. But to me, I feel like it would be very beneficial to know if you do have a genetic component that does increase your risk of a cancer, because then we can help you with the additional screenings that you need. And then as far as we have some genes that cause, of course, breast cancer, we have some that cause your risk of colon cancer. So then we can make sure that you're getting the colonoscopies and things you need in a frequent, time.
Hmm.
I feel like it's super beneficial. I don't feel like every cancer patient needs it, but our doctors here are very good about knowing what um, needs to be done or what makes a patient high risk and allowing them to have that genetic testing.
Our last break is here, ladies. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White, pharmacist Brad White, and I thank you for joining us. Let's get back to the last segment of the show.
All right, so continuing my genetic testing questions, if you don't mind. This one's for
Oh,
Heather. So, I wonder if you use any genetic testing in your nutrition to help cancer patients. And I only ask because I know I'm a poor methylator from my testing that I've done personally. So I take an extra supplement of activated methyl tetrahydrofolate. So I make sure that I get that benefit. Do you see challenges like that face cancer patients given they have a more specialized need for nutrition in your practice?
Oh, I would love to if my patients came in with that knowledge. Unfortunately, in my experience, most have not come in with genetic testing done. And so they're coming in with none of that knowledge, without that knowledge. So that would be wonderful if we had that piece. I would love to see a best case scenario is that everybody is advocating for themselves doing genetic testing when they're healthy and well, and then having that knowledge if they do end up embarking on a cancer journey one day.
Okay. How about I wondered if each one of you might be interested in sharing one of your favorite memories or favorite stories about helping a patient through a troubling time. It's one of those things I think that it makes your job rewarding, I'm sure, to help a patient through a challenge. And I think it would be a nice story to share. So, um, Heather, if you want to start, or Erin, depending on to put you on the spot, but I just wondered if you might have something that pops in your mind right away that really was memorable.
Well, my job is very rewarding, although difficult. But I think a special place in my heart is our head and neck cancer patients. That's a very difficult, every cancer is difficult to go through. But many of them come in with a lot of nutritional needs. And so to see them make it through a journey with adequate energy, optimal nutrition is just very rewarding. And how I usually describe that is at the beginning of their journey, I like to say, think of yourself as an explorer. The foods that you used to like may not taste good anymore. And so the people who do best on this journey, and Dr. Wab is a phenomenal, we have a great head and neck radiologist here. And the people that do best on this journey are open to change and they're willing to try new things, even if they say, I used to hate that. But eventually, if they can't taste and they're swallowing, having pain with every swallow, sometimes we're willing to try things that before weren't successful for us. And so without naming a particular incident or patient, they're very rewarding to help through this journey and to watch them follow through. And I tell them, like, the people that do best listen to what we say. We know what we're doing. These doctors, our team has been doing this for many years. So we have a lot of experience and we want to help you get through this journey at Best Health.
The dietitian dietary department prepares some special meals like steak, grilled out on the balcony and stuff like that, or what?
So
Yes.
this is an outpatient. Our cancer center is outpatient. Yes, if you're inpatient, that's a totally different nutrition department.
I see. Okay. I just kind of thought now, and if you ladies had been in our conference room this morning for the program, you'd have had Johnny's Donuts. So,
Oh,
sorry.
All foods in moderation.
Sorry.
Be mindful of those added sugars.
Yeah. Oh, there's no sugar in them. Come on. Gosh, they are tough to beat, aren't they? And
yeah.
How about you, Erin? What comes to mind?
We have several patients or several women that they try to continue to work through out their treatment, and it gets difficult sometimes. If they're the breadwinners and they have a hard time, keeping up with the household necessities. And so we are very lucky that we have several local grant organizations as well that will help women with utilities, high deductibles, any, medical bills, things like that. So when I think about one patient, for instance, we just helped her with all the grants that are local to help her pay some bills and to help her, be able to take the time off that she needs to heal. And I think that, there's many of those women that endure that. And so there isn't one specific, but there's many that we do help in that way. So it's just rewarding to be able to help them, take the time off that they need or free up some costs for other things by, giving gas cards, grocery cards, things along those lines. So,
over the years, I've been a pharmacist for a long time, and I opened the Canton Medicine Center. It was Medicine Shop at the time. And I really had a lot over the years, a lot of patients with cancer. And I can remember one lady in particular, and she was a very interesting lady. She was what we used to call a war bride from, World War II. And she and her husband, Ron, really had a very good life together, but she got cancer. And she would set goals. and she had a fair amount of grandchildren. And she would, every time a grandchild was going to do something or whatever, she'd use that to set a goal to get going and keep going, you know, and all that sort of thing. And she lasted a long time setting these goals. And I would also visit the patients of the store, the pharmacy, in the hospital. And the one lady that I visited one day um, was bone cancer afflicted. And the cancer actually, when I got in the hospital to talk to her, she said, well, she said, both of my legs have been broken by the cancer. And, but her brain was sharp as a tack.
Mm.
And she was another lady who set goals and, just simply to keep going. And those two ladies really stimulated me in my career to help people. So,
Yeah, definitely. I think setting goals helps your frame of mind too. It kind of helps
mhm,
take looking forward to events, helps kind of take your mind off of what's
mhm,
happening. And I think it's very important to
mhm,
set goals and have a good outlook as much as you can. I mean, I know that's very difficult, but I think
mhm,
how you perceive and how you react to your treatment and to the cancer mentally is very, very important to how you're going to do overall.
now,
Absolutely. We're
are all the
holistic people.
are
Yeah.
all the hospitalized cancer patients, are they in the new facility, or are they throughout the hospital?
No. So the new facility is all outpatient. So our oncologists or over here that see patients, we have medical oncology and gynecologic oncology over here. And then a lot of our cancer patients now do get their chemo as an outpatient. We used to give a lot of inpatient chemo. We don't do
Mhm.
that so much now. So if it's a cancer patient that is admitted, there is a dedicated floor in the hospital for cancer patients.
Hmm. How about tell our listeners how they can get more information about Aultman Cancer Center?
Sure. So you can visit our website. It's www.altman.org and just follow the link for cancer services. Also, we have what we call a navigation line that comes to us, the navigation department, and that is 330-363 6011. And that also I talked about earlier, if you're not sure if you qualify for a low dose CT for, cancer, for those that smoke, for lung cancer, you're welcome to use that number to see if you qualify. Also, that number, you can give us a call regarding free cancer, the breast screenings if need be as well. There will be more social media that'll come out about the free the breast mammogram event in October.
Hmm. What do we got, Brad? 2 minutes?
Yeah, we're about done. Thank you, ladies. Great information for the community, and we appreciate your service and dedication to their causes.
Thank you
Thank
so
you so
much.
much.
Thanks you to our guests, Erin Meek and Heather Nist-Weisel from Aultman Cancer Center. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman's Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC. Thank you very
The
much for
preceding
coming
program
in.
is sponsored by the Medicine